Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Dr. Julia Vu. She's vice president of GTM North America at Elsevier, and Dr. Colin Banas. He's chief medical officer at DrFirst. Welcome.
Hey, good to see you again,
Good
John.
to see you, John. Thanks for having us.
Yeah, excited to have you both on. Lots to talk about, lots happening in your space. But before we go there, Colin, why don't you start us off? Tell us about yourself and DrFirst.
Oh, sure. This is the fun part. Colin Banas, Chief Medical Officer for DrFirst, internal medicine physician by training, and coming up on my 24th year in informatics. It's been a long run.
Great. And Julia, how about yourself and Elsevier?
Great. Hi, everyone. Julia Vu. I'm Vice President, Go-to-Market North America at Elsevier, managing our provider solutions. Like Colin, I have a hospital background as well, pharmacist by background, and been 15 years in healthcare IT. So started in hospital practice, worked on the EHR, and currently working on AI solutions with Elsevier.
That's awesome. Well, let's dive in. And maybe Julia, you could start on this one. I'd love to hear your experience and what challenges in clinical practice brought you to where you are today.
Yeah, sounds great, John. So when I first started practicing, I was in the hospital pharmacy, working on a Tron computer, if you will, and dot matrix printers. So you can see the stage where it's a very fragmented workflow. So I had two different EHRs, two different content systems. So there was a point being in the pharmacy, 2 in the morning. I just said to myself, it doesn't have to be this way. So my career was led into the EHR, working with Siemens, working with Cerner, doing product strategy, go-to-market strategy. And it led me to the next phase where when I was working on the EHR, the question also came up, how do I get my primary literature? How do I get this embedded in my structured content? So that's what we're working on today.
That's awesome. Colin, I'd love to hear your journey. I mean, we've had you on the show a number of times, but how did you go from doctor to now, working with health IT solutions to solve some of the workflow challenges?
Yeah, I still don't know. No. It's interesting. It's probably not too dissimilar from Julia, which is I was when I finished residency, I stayed on as a hospitalist at a large academic medical center, and we were on paper. We did have a system. We actually did it. We had two systems, so this is more and more similar. But we weren't using the system at all. There was probably very little clinical input, clinical governance into it, and a fellow hospitalist and myself basically got together and made the pitch like, you guys need to have clinical input into this. This could be so much more. This could be so much better. And we started something called the Office of Clinical Transformation together. And next, one thing leads to another. And all of a sudden, I'm CMIO. And that title really didn't exist back in 2005.
Sure.
I could count on one hand the number of people who might have had that title. There was sometimes you could find a medical director of an information system and things like that, but CMIO was not a thing. And of course, now it's a career path. There's, fellowship training. There's opportunities galore in the informatics realm, but it is something that I just fell into. Right place, right time, with a supreme interest in not only computers, but also technology at the point of patient care, all to make it better.
Yeah, I love that. It's fascinating to think that you both kind of started building solutions back in the days of meaningful use, right? Which those time frames
Exactly.
kind of hit, but you've been building these next generation solutions ever since. In this next era of healthcare AI, like what are some of the challenges that you still see with e-prescribing and clinical decision support that you're focused on? Maybe you could start, Colin, and then Julia.
Yeah, one of the things, and it's even more so today than it was, 20 years ago, which is the the growth of the knowledge that you need to have at your disposal in order to do this correctly and to do it safely. So the number of drugs coming out, the ways that we use them, the indications, the way to dose it, the things you need to look out for, like it's also complex, and it's very hard to keep up with, and it's growing every day. It's growing at an exponential rate, and I'm not making that up. And so the corpus of knowledge that you need to have readily available is it's just not manageable. And this is actually one of the great things that computers happen to be good at, and even more so AI happens to be good at. And so I think this is just probably the next iteration of what we are asking health IT leaders to do. First, you mentioned meaningful use. It was digitization, like let's get this thing digitized. Then it was maybe evidence-based medicine, or embedded clinical decision support. Great, now we've done that. And now we're getting a little bit past automation all the way to AI. And so there, every couple years or so, this thing just sort of seems to ramp up, and it's what we need to be on top of right now. And so I do think AI is tailor-made for a lot of these use cases that we're going to dive into.
Yeah, that's fascinating. I recently wrote an article for someone about Doc Baker in a Little House on the Prairie, and the clinical knowledge that was available to him to try to treat a patient. And like compared to today, right? You're right. It's orders of magnitude so much more complex. How do you even address it? Julia, what would you add?
First of all, great show. I can't wait to read that article. And well said by Colin. I couldn't agree more. We also did a survey with Elsevier with over 2,000 clinicians, where, to Colin's point, they're looking for optimized solutions. So they're looking to AI. So already 30% of clinicians are using AI for drug interactions. But as Colin mentioned, there are clinicians behind these tools. There are safe ways to use it. So it's a matter of harnessing people's interest in AI and doing it in a way that brings them back to that medical content domain, and in a way that the content isn't a problem anymore. Getting to the content is solved through AI.
Interesting. Julia, I'd love to hear, Elsevier and DrFirst have a partnership that integrates generative AI powered clinical decision support within the e-prescribing workflows. What are some of the problems that still remain to be solved that, that you talked about there? I think trust, it sounds like, is one of them, making sure you get the access to the right info, that you can trust the info that you're getting. We hear a lot about that in the industry, but I'd love to hear, what do you see as some of the challenges that you're working on and working to solve, with this partnership?
Yeah, great question. So Colin, myself, and then also Nick on his team often talk about this, that oftentimes when you're in the prescribing workflow, you have an idea of what you're going to prescribe, and there's an element of perhaps confirmation bias in that. So we're really leveraging AI to support the prescriber, where we fit into their workflow. We also provide them the latest content that Colin had mentioned. So we're working on that. And the next phase, because Colin and I both came from EHR and meaningful use, how do we take that one step further with taking that AI-powered evidence-based content in the e-prescribe workflow and taking it to suggested action? And that's what I'd like to look at next with Colin and everyone listening in on the call today, because we have spent the last 15 years removing alert fatigue out of the room. So we're very conscious of bringing alert fatigue back in the room, even if we have AI technology today.
Interesting. Colin, what would you add? And talk to us about the value of your integrated solution for providers.
Yeah, I think obviously we're just at the beginning of this. I mean, it doesn't feel like it because of how rapidly this thing is evolving, but generative AI is 2, maybe 3 years old. And we are picking off what I would say the easy stuff first, right? The things that can be automated safely, the things that lend themselves to these kinds of queries. But what's coming next is the fun stuff, which is this idea of a co-pilot, this idea of suggestions that are non-intrusive, that are actually helpful, happening in real time, at the moment that they matter the most. And so to do that in a thoughtful way, and to do that in a way that can still that our providers can still trust, right? Everyone's worried about the hallucination. Everyone is worried about making a mistake that was automated, that they should have caught, or that they would have caught had they not relied on this. And the idea is not to replace the human, right? It's not human, or excuse me, computer greater than human. It's computer plus human greater than human, right? And it's the same thing can be said with AI. It's, you know, we've all heard it now. AI is not going to replace doctors, but doctors with AI will replace doctors without. And it's becoming a very crowded space. That's the other thing is how can we do this in such a way that differentiates us or makes us, trustworthy? And so it's trust, it's co-pilot, it's fun times, which is what I'm really excited about working on.
It's
Yeah.
interesting that we worry so much about hallucinations. When you think about, when someone used Hippocrates back in the day, if they looked at the wrong drug reference, we didn't worry about them like searching the wrong drug reference because the human would solve that. I mean, that's kind of what you just described, right? The human's gonna, and certainly something could happen, right? But that happened before. And I think that's always a challenge for us. Julia, what would you add to this as far as the value that providers are going to get and the benefits of having this optimized AI powered evidence based tools, at their fingertips?
Yeah, that's a great point with Hippocrates being newer on the scene there and still on the scene now. I really love what Colin had said before with the human robot equation there, that is from our intro before, what we were really focused on as clinicians wanting to be in this business and harness that. So at Elsevier with our AI powered solution, we also had an AI evaluation framework around it with a clinician in the loop. And that's very much from our pharmacist background with ISMP, best medication practices. So it's a combination of the robot and the human, like Colin had mentioned. And the outcome of that, why does that matter? We build these optimized tools to support with the e-prescribe and the prior auth that Colin does well, getting to the evidence-based content, the Journal American College of Cardiology guidelines with the Elsevier side. And what does that do ultimately at the very end of the day? You have your workflow, but you also get to practice at the top of your license. So you're not searching for in Hippocrates, you're not searching in all these disparate resources. You're in one place. You don't feel like the solution is grafted on. You have access to everything you need there. So again, it's really about clinicians being in it with the robots, but supporting fellow clinicians to practice at the top of their license.
Yeah, I love that. I heard that you can actually earn CMEs while in the workflow. Talk to me about that. Like maybe Colin, you could talk about, like what is this opportunity to earn CMEs literally in your workflow? I think every clinician loves that idea.
Oh, everyone loves doing CMEs, and the
They
old
love
days of
getting CMEs.
no, well, the old days of flipping through magazines to find the quiz so I could, catch up on my CMEs that, because they're all due next week and I forgot about it for 3 years. No, this is perfect, right? This is the perfect platform to educate and reinforce in real time. I mean, I'm using evidence-based guidelines and literature with the patient right in front of me to answer legitimate questions. And of course, that's the perfect time to be earning CMEs and continue education, no matter what your specialty or practice may be. So the fact that we were able to do it in real time and embedded workflows actually just makes it all the more attractive and makes a ton of sense.
Yeah. Julia, I mean, Elsevier is
Yeah.
known for your education, known for, helping clinicians, educate themselves. What's your perspective on kind of earning CMEs in the workflow?
No, thanks, John. Yeah, I love the way that Colin painted that because we all feel that urgency. Mine are due next year for the pharmacy world. So it part of the workflow with our AI powered tool when you're doing the question and answer and the point back to the evidence-based content. As Colin mentioned, you get to earn and claim CME at the same time, and it's accredited through the AACME. So why is that important? We all are practicing physicians. They all have day jobs, right? They're at the point of care. So having CME with AI combined, it's very powerful because it supports two things. It supports your day job and supporting optimized patient care, pointing you back to the guidelines that Colin had mentioned, where we don't have time to read the 123 pages of the guidelines, but if it points Colin directly to a specific section on diuretics on page 118, it's giving him the confidence to practice at the point of care. And then secondly, while he's doing that question and answer and having the confident patient care, he's claiming CME and he's on time so that he doesn't have to wait to submit them the week before they're due. So we're really excited about that workflow to say, hey, we know you have a day job and your day job takes all day and you have to collect CME. What if you could do both?
Yeah, it's fascinating. I mean, while you're doing your day job, you are learning, so it makes sense to give you CMEs for the work you're doing. It's fascinating.
Exactly. And it's great with reinforcement learning too, as Colin has mentioned. Those are my CMEs when it's a test afterwards. But if it's in the context of when you're with a patient, I just remember that a lot more.
Yeah, that's true. It's a practical way to learn.
Yeah.
So Julia, talk to me, like, where are you going next with your partnership, and maybe even more broadly, where do you see the industry heading with AI?
Yeah, great question. I think first thing first, we're probably going to Vive and HIMSS next. I know Colin and I always run into each other there. I think our booths may be near each other again on the main aisle. So that's where we're going next. And related to that, Colin and I also want to align our work to external guidance. So we work very closely with NCPDP. So we want to inform what's next with interoperability. And then also on the Elsevier side, we're taking integration one step further and delivering our solution via API so we can fit more seamlessly in the way that you need in your platform, whether it's Colin's platforms or anyone on the call today.
Awesome. Colin, how about yourself? What's your perspective on where you want to take the partnership with Elsevier, but also, where the industry is going with AI in general?
Yeah, I love that Julia finished with the seamless integration, because that's the next step, right? Multimodal AI that is contextual to the vagaries and specifics of my patient. So, it's one thing to Google anticoagulant guidelines for my 70-year-old female who is status post ablation, but it's a whole nother thing where the integration understands the entirety of their medical history and things that have been tried and failed, and then couples it with evidence-based literature and recommendations, because there's only so much I can Google and there's only so much I can remember about my patient. And so I think context is everything, and being able to do that again in the moment in time in which it matters is especially powerful. And then I'm really excited, like I said, for multimodal. I want to converse. I want to bounce things off of my AI co-pilot, and because medicine is very nuanced. It's not always cut and dry. There are options and there are risks and benefits that need to be weighed. And so being able to think this out. I'm a very, visual, as well as, I'm a talker, in case you haven't noticed, John. So being able to, engage in these platforms in the manner in which you choose. Maybe you're not a talker. Maybe you even want to type it all. It doesn't matter. You're going to be able to have these options, and they're going to be contextual and seamless. And that's what I am very excited about.
Yeah. I mean, it's fascinating to think about. I was talking to an interop vendor recently, and they said that they looked at their patients, and one patient had 5,000 pages of clinical documentation, to your point, that had to be sorted through and understood. Now pair it with everything that Julia and Elsevier have on the clinical understanding side, the 500 pages of one research study, when all you really need is this 3 paragraphs, right? This is the challenge that I think we're talking about. But to your point, it sounds like you're creating this integrated solution within the EHR. They probably don't even know it's DrFirst or Elsevier. It's just their EHR that's integrated them into it. Is that the vision, Colin? Is kind of just that intel inside, it powers it, but in providing these solutions to them?
I think so. I think seamless is a key factor. I think the integration needs to be in the format in which you want to interact with it. So mobile, tablet, desktop, laptop, doesn't matter. But I also think it needs to, you know, just like you said, the Intel Inside, like that sticker, they put that sticker on there because it was supposed to promote trust. It was supposed to, help with quality. So same thing with any partnership around, AI or any, integration. How can we make sure that the things that it's surfacing can be done in a way that is transparent and that I can trust, right? And so one of the key things around these types of solutions, especially with what we do with Elsevier, is being able to see the citations behind it. Like, why did it come up with that recommendation? Where did that come from? And how recent is it even? And you can sort of see those things in real time. Whoa, wow, that came from the Journal of Cardiology. Okay, those I probably believe them over my random Yahoo search. So, those are the key attributes that I'm really looking forward to.
Yeah, that's interesting. Well, I think, when I look at the industry, I think, everyone would agree that Elsevier, DrFirst are two trusted brands. So it's great that you've come together to help solve some of these important problems. And like you said, make it a seamless experience for doctors. Julia, anything you got?
Yeah, I'd like to emphasize what Colin said there too, where with the human and robot equation or that expression, the sum are greater than its parts, right? So there are items that Colin's team does at DrFirst that really supports the workflow, and they're great at that. But then when you infuse AI from Elsevier, that you have something even more powerful. And I love what Colin had said there, because being on the mobile app and an intuitive way that Colin has developed that, or being in the EHR, one physician that I work with has told me, Julia, I feel like solutions are grafted onto the EHR. So to do something optimized and seamless and innocuous, if we can use that word, that is really solving the problem here, instead of having another AI add-on, make it feel already a part of the workflow. So I love what Colin said there.
Yeah. Well, I appreciate that you're collaborating together. There's a lot that want to just build everything themselves, and I love that you're collaborating to make it a seamless experience and use your various expertise to help solve problems. So thanks for coming on and sharing about this great partnership between DrFirst and Elsevier. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks so much.
Thanks again, John.